Dr. Matt Young. I'm president of the American Academy of Implant Dentistry. Today we're going to be talking about our annual meeting. We have our annual meeting coming up in Phoenix, Arizona. It's going to be an awesome program. We have amazing main podium lecturers. We have great hands-on programs for implant dentistry, prosthetics, and we also have great workshops and a lot of networking opportunities. And you can also go through the credentialing process. Today, we're very honored to have Dr. Sompop Bencharit, and he is the Innovations Director at Workman Dental School at High Point, North Carolina. And he's also the Associate Dean for Digital Dentistry. He's a prosthodontist. He's an amazing speaker, great guy, and I'm so glad to see you again, Sompop. So tell us about your lecture that's coming up.
So thank you, Matt. Thank you for the kind introduction. So my lecture will be all about innovation and principle of the full arch implant. You know, nowadays we place more implant than we ever place, right? And various people have placed more implant than ever. I was going to go through some principle fundamental of the positioning of implant and where the implant is supposed to be. Go through the new technology and innovation in full arch implant prosthesis.
Very nice. Very nice. You know, the full arch prosthesis is getting more and more widely used out there. And, you know, it's a great service for our patients. You know, tell us some of the things that you've seen change just in the last 5 years for full arch implant dentistry.
That's a great question. So, you know, in the past, I would say 5 to 10 years, things are shifting rapidly from, you know, we used to do full, freehand. You know, we used to converge the dentures. Nowadays, I don't remember last time I converged my prosthesis. I don't remember last time I don't place the implant using guided surgery, right? So we do guided surgery all the time now, and the pickup of the prosthesis become even easier than ever. And now we can actually recording the implant position much easier and much more accurate than before from, you know, digital impression through like photogrammetry. So I think that it's a great time to be a dentist and a great time to do a full arch prosthesis.
You know, photogrammetry is a very interesting one. You know, it's a amazing technology. It's also changed in the last few years. There's a lot of people who have been unsure about whether they should incorporate the technology in their office. There are, you know, it's an expensive tool to be able to use. Do you feel that it's gotten better and more predictable and easier to use over the last few years?
So you know, it's interesting that you talk about this. On one hand, I think the photogrammetry probably the most accurate way to record the implant position, especially for full arch. But you know, we still redo a lot of prosthesis, right? Because the teeth are worn down, the implant fail. We redo a lot of these full arch prosthesis, and you realize that, you know, reverse scanning also another good one. And the intraoral scanner, which we would talk about it, that, you know, the new Medit and the new iTero Lumina had come a long way, and the different type of scan body that are now more accurate than we ever had before, and it's just going to get better every day.
What would you say to people who are not using any digital dentistry right now in their practice? What are some of the things you can say about incorporating the technology and whether they should wait or really embrace that now?
Yeah, I think that's also a part that I will add it into my talk as well, because there's still, you know, a lot of people who are afraid of technology. A lot of people still hold back on technology. I would say, though, that number one, the technology evolve constantly. So it get better as we speak, it get better. But minimally would be intraoral scanning, you know, intraoral scanning, cone beam CT, and maybe some additional other like 3D printers. So these are probably the minimum step for people who want to start to get into digital dentistry. I would not probably go from, you know, you can go to AI and robotics and photogrammetries and, you know, digital face bow and all those things, but that probably too advanced for for the newcomers.
Well, that sounds good. I know you're going to touch on those things. So, for those whether they're experienced or newer digital dentistry, you're going to have an awesome presentation. I know you get into some very complex subjects, and you start off with a good baseline. You're at the university. What level are you teaching at the university? Are you teaching graduate students or undergraduate students or both?
So that's a great question to ask. So I'm actually just put together the integrated prosthodontic curriculum for our DMD. So right now I'm teaching DMD D2 class. And our curriculum is different, meaning that we integrate the digital dentistry in all part of prosthodontics. And it is combined from digital dentistry, from same-day crown, to guided implant surgery. In between, you have digital complete dentures, and we have a digital design of RPD. So all the way through, they will be with me for a semester and a half, learning from right now. They do the same day. They will do same day crowd like next week, until they will do guided surgery probably sometime in February.
Wow. Wow. So these are dental students who are learning digital planning, digital dentistry, digital prosthetics, and digital guided surgery.
Yes, and these are DMD, these are D2, and they're learning inlay, onlay, and veneer in the summer, and they already learn how to scan and design those and print them in-house, and they cement those printed. Those are for DMD side. I also have a 2-year program for digital dentistry fellowship. Actually, AAID qualify if they want to kind of take it further after they graduate. And these are people who graduate dental school already, and I train them to implement digital technology into their practice, education, and research. And they will be there
Wow.
with me at the AAID.
That's awesome. So for those who have graduated, 5 years, 10 years ago or more, you know, the dental students right now are learning this technology, and they're coming out with their curriculum, with your guidance using this technology. So it's really, really time for everybody to embrace this technology, because, we're learning in dental school, people are graduating as new grads with this technology, and they're going to incorporate that within the practice. So, we have to incorporate this and keep up with the current education, and then surpass it.
Mm-hmm.
You mentioned AAID. Tell us, you have a lot of lecture opportunities. I was looking through your CV. You lecture all over the world, and why do you come and lecture to AAID? What's your draw?
Oh, it's truly an honor to be speaking at the AAID, and I was like I a recipient of AAID Research Foundation for many years, and an AAID Research Foundation have been really great for our residents, our dental student even, and our junior faculty. And I think the AID is probably one of the biggest educators for implant dentistry. And I think it's important because right now we place more implant than we ever placed, and education is probably the most important thing especially for newcomers, and also people who place implant for a long time. You need to keep up with the new technology.
That's awesome. That's awesome. Well, I'm glad you mentioned the foundation. We have the AAID Foundation, and we have donations that come in, and then we fund great projects like you're running. So the students and faculty can run projects on implant dentistry, and many of those research projects wind up being published. Sometimes they're published in the Journal of Oral Implantology, led by Dr. Rakowski as editor, and many other journals. So it allows us to put education forward and develop innovation. So we're really glad that you're inspiring your residents to go for these grants, and it's really moving our implant dentistry forward. And so it's great to see you, and it's great to see that you're inspiring leaders to become part of American implant dentistry. You also mentioned the bringing some of your residents and students down. The credentialing opportunities we have with AAID are great. Have you seen some of your residents and yourself go through the credentialing process with AAID?
Yeah, I think my previous institution, many of our trainees have gone through the credentialing process, and I think it's important for us to credential people. Number one is it's not just to put the plaque into the wall, but to carefully credential yourself, because everything should be credential, meaning that you have to update yourself before you treat patient. You think about it, implants is the medical device that will stay in the patient mouth sometime forever. So credentialing process is probably one of the most important thing, and I'm glad that AID has been very active on helping us credential our provider.
Well, that's awesome. Well, thank you very much. And, it's going to be great to see you and great to spend time with you during the lectures and some of the networking opportunities. Thank you very much, Sompop Bencharit. And we look forward to your amazing lecture.
Thank you, Matt, and look forward to seeing you.
Sounds good. Come to AAID 2025 in Phoenix, Arizona. Have a great afternoon, everybody.